most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
I
therapist.
had trouble getting that out. And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about how a hip movement program can help take your hip pain away.
Right.
Now, this is interesting, Brad, because I'm assuming a lot of people are going to think that my hip hurts. I don't want to move it. I want to rest it.
Yeah, or protect it.
Right, but that's not true. In this, what you want to do, movement increases blood flow, improves oxygen, nutrients going into the joint.
Right. And this takes in some consideration. If it creates a lot of sharp pain, we're not going to do it. So we're going to show you some options to get it moving, working around the pain and making it
right, because if you think movement only involves running or jogging or something like that, that's not what we're talking about. We want to protect the joint while it's moving.
Right.
Now, the other thing is it actually promotes the synovial fluid, which is kind of the oil of the joint.
Yep, the lubrication that keeps things moving smoothly, which in arthritic takes, it's doing the opposite. It gets it rough, and so we're trying to eliminate that.
Smooth it out.
Mm-hmm.
So here's our recommendations, and we got 7 of them. 7 of them.
7? That's a good number,
Yeah,
Bob.
I should have used it in the title probably. So let's start off with the first one. This is one you can do as soon as you wake up in the morning. I'm sorry, Brad. I think we're going to have to move this.
Oh, wow. Well, we'll get them out of the way. They're not heavy.
So the first one you're going to do is trunk rotations. I'm actually going to go on this side, my better side. So you won't have shoes on in bed probably.
Well, some people do.
Maybe some people sleep with them.
I thought you did, but we won't talk about that.
So you're going to put your legs up like this in what we call the hook line position. Your feet are flat on the bed, and your knees are bent, and you bring your knees together and your heels together, and you're going to just rotate back and forth. Right. It's a great one. I have all my hip patients warm up their hips in the morning by doing this. Get it ready for the day.
Right. Not a total hip patient.
No, not a total hip
Okay.
patient. Sorry. Good point, Brad, because we don't want total hip.
Right. So look at his feet. They are touching it. It works out nice, and his shoulders aren't moving.
Right. I'm not going like this along with it. If one side is painful, avoid it. Just work on the non-painful side, and then every once in a while you can check it over again and see if maybe it's lubricated a little bit and feeling better. All right, next one is actually going to involve equipment.
Don't put it in that way.
Oh, sorry.
You won't have a problem with a mic in your pocket.
Yeah. Brad, do you mind grabbing FITGLIDE, knee glide?
Oh, you bet.
So now, if you're going to, especially if you're going to have surgery, and you're preparing for surgery, or even not, if you want a great way to move your hip in bed.
Yes.
Let's start off. What do you want to start off with, Brad?
Well, we could start out with
the FITGLIDE?
Yep. So these are both the same. This one's obviously for one leg. This one you can do both legs.
Now the thing is, these can be used on the floor also, but in this case, when you're trying to get a lot of hip movement, you want to do it actually lying down. If you want to get a lot of knee movement, then you're probably sitting.
Right.
Wouldn't you say that?
Yep.
Agree with that, Brad?
And if your hip is painful when you walk with weight bearing, this is even more advantageous because you get motion without that weight bearing.
Yeah, and the thing is, what's nice about this is it's so portable.
Right.
You can lift it with one finger, literally. It comes with a stand too, but you won't use that in bed.
Yeah.
So, all right. So, I'm going to get into position here, and I can just work back and forth here. And you can work your hip in the morning again, or if you're taking a nap in the afternoon.
Yep. So it's getting a lot of hip motion, and you can do this without the FITGLIDE if you put something on your bed that has a smooth surface.
Yeah, I don't know what it would be.
I know. Well, we have like a cake pan, a big cake pan. There's been people that have done that. Yeah, they put it on the floor. I mean, that's why we invented this, because nothing works really well, but this works really well.
Now, you're going to want to, if you don't have shoes on, which you won't, you want to put a towel on here because it's a little hard on the heel to be in this position for a long time.
It's just more comfortable. I mean, some people may not bother.
Now, if you are only having trouble with one hip, or you're only going to have surgery on one hip, and you want to buy the lesser, Brad's doing a gorilla crawl there, You could actually get the knee glide, and that's just for one leg.
Yep. And
This is really good for after knee surgery because you want to get the knee moving.
if you've only got, if your other hip is perfectly fine and this one really needs some work, maybe you just want to get this. It's a little more convenient.
What I like about these is that the FITGLIDE is that when you're done, then you can actually use it on the floor and keep, get a little cardio, get a little exercise while you're watching TV.
Yeah, you're not just going to use it for this only.
Yeah.
I'm going to walk in front of you again, Bob.
All right. Well, that's the next one we're talking about, Brad. We want you to try walking. Now, you're going to say, well, I'm having pain with walking. Then you need to use a GAIT aid. And I know a lot of you are going to protest.
And so a GAIT aid could be a cane, it could be a walker.
A crutch.
Crutch, yes.
Yeah.
Yep.
And the thing is, if you're allowed, take some weight off of it, it may calm down enough to the point where you don't need the cane anymore. But either way, walking, is really important for the lubrication. And even get some weight bearing.
The strength of the muscles, which is critical. You don't want to get things weak, and then it just is a spiraling, a downhill spiral.
And what you often see with somebody who has hip pain is they have what we call a Trendelenburg. Brad, do you want to show what Trendelenburg is?
That's those people that you see them, they go like this.
And that's
eventually you'll walk into the camera, but
that's weakening the hip.
Right.
So you're not doing yourself a favor by walking unusual like that. A cane would correct that.
Right.
But use it on the right side. Correct side.
Yeah, the correct. Right. So if your right hip is painful, you're going to use the cane or the crutch in the opposite hand. And then, it'd be the opposite the other way too. And I've had people use the cane. They say, it's like at a pain level of a 5 or a 6, 10 being the worst. And they use the cane and they say, oh, wow, that drops it down to a 1. I can hardly tell it.
Yeah.
Then you use the cane with the idea that you're not going to need it forever.
Right.
You're going to do some more stretching, work with it, and hopefully improve over the next week or two or whatever.
And Brad and I both agree on the instructions for using the cane. We just tell the person, put it in the right hand and start going.
Or because put it in the correct hand
and start going. Because if we give them directions, they seem like they screw up, but a lot of times people just naturally do it right.
Right.
So,
do we even want to say what the right?
No.
Okay.
No.
We do have videos on how to use it.
We have a video in the programs. So
okay.
If you want to see this, by the way, in the programs, we have free programs on our website, bobandbrad.com. Go to the program section and look for the hip videos.
Yeah, so programs mean we got a program for back, we got a program for knee, and we got a program for
plantar fasciitis. We're working one on for neck.
Yep.
But anyway, there's a printout there too with each video, which will print out what you can do. Like you can do, all these recommendations are printed out.
Right. So you don't have to go back and look at the video every time if you can't remember one little thing. It's right there. Read it, and it's like, oh, I remember now.
All right, next one, Brad. Water exercises. When you're doing exercises in the water, obviously you're going to have increased buoyancy.
Yep.
And so you're going to have less weight on the hip, but you also get some resistance.
Oh, right.
In the water.
Oh.
So.
And water people can always do more in water in regards to pain.
Right.
It's amazing how much more you can do in the
Especially
water.
warm water.
Yeah.
It's the problem is you need access to a pool, and you might even need, classes and the whole thing.
There's probably a small percentage of people who have that option available
to them. Right. Number 5, biking outside or biking with a stationary bike.
Right.
But Brad, do you want to talk about seat height?
Yeah, you really want to make sure that the seat is not too low, which is by far the most common error, whether it's outside or a stationary bike. So when and we actually have some videos on seat height that go through this in detail with a real bicycle. But when your foot is all the way down on the pedal, and you shouldn't have to reach for the pedal, or on the other hand, when it's all the way up to the top, coming around, if your knee is way up here, it's too much, and you're flexing that hip too much. Again, go Bob and Brad on YouTube, bicycle adjustments, and you'll get a video that goes that in detail.
It's funny. Every time my wife and I are out for a walk, we'll see somebody biking, and they the seat's too low, and I just want to go up and talk to them, But
very common. Either the seat's too low and their tires are half flat. Drives me crazy.
Yeah. All right, number 6, kind of like number 4, swimming. Again, yeah, there you're not even putting your feet on the floor on the.
Right. What's the difference between this? Oh, the pool is
doing exercises, and swimming is just doing laps or whatever you normally do. All right, and the final one, number 7. We just want to mention this. They have a great product. If you know, it's going to cost you more, but if you have the room, we got by TEETER. It's a FREESTEP LT1. And this is a cross trainer, so you're working your arms and your legs
in a seated position.
In a seated position
with a backrest.
I'm really impressed with this because, and we'll put up a photo of it, because it's really high quality for the price.
Right.
Brad and I are used to using a New Step, which is a different brand, with our patients in the clinic, and those run. What, 6,000, 7,000?
5,000 to 7,000. They're very expensive. They're commercial grade. They're made for in a clinic. They're made for in a fitness. This TEETER is very well built. It works great. The price was $700-800.
Yep.
Compared to the other ones, you know.
Right.
We're just giving you our opinion on it, on a good product for that price. There's other ones out there.
Well made.
Do your homework and see, but I would definitely, put that on the list.
All right, that is the end, Brad.
Oh, yeah.
We just finished another video. Thanks
Take
for
care.
watching.